Hello, hi, I'm Dr. Reshma Rakshit, and I'm a consultant gastroenterologist. Today, I'd like to talk to you about heartburn and acid reflux. These are very common conditions, often used interchangeably. 1 in 4 of UK adults suffer with this, so I want to talk to you in detail about it. Heartburn is a sensation of pain or discomfort or burning felt in the middle of the chest, often rising from the lower end of the breastbone, going up and outwards into the chest. This is usually triggered by meals. Reflux means regurgitation or pooling up of liquid from your stomach into your gullet, which can often be felt in the throat or even in the mouth. These are often associated with other symptoms, such as a sore throat, cough, increasing symptoms at night, after eating heavy meals, or bending down, or when bending down or stooping during gardening or housework. In a human being, the function of the gullet is to move food down into the stomach. In the normal stomach, acid is produced, and this helps to digest our food. Now, if there are certain risk factors, this food, fluid, and acid can move up into the gullet. And as the gullet is not used to an acid environment, it creates symptoms such as heartburn. Common risk factors include weight gain, especially around the midriff, eating late at night, eating heavy meals, having carbonated drinks or fizzy drinks. Please see your doctor urgently if your heartburn doesn't get better with over-the-counter medication or by simple lifestyle changes that you make, or if the food is getting stuck in your gullet, or if you've lost a lot of weight unintentionally, or if you're vomiting or you have persistent symptoms. If, however, you start to see blood in your stools or you vomit blood, this is an emergency and you must go to A&E. The best way to diagnose heartburn and reflux are by taking your history, and that's what your GP or someone like me would do. However, to look at this further, we would want to do an endoscopy, which is a camera investigation of your gullet and stomach. This can be done with you awake, with us spraying the back of your throat with a local anesthetic or with a sedative which we administer through your veins. The test takes 10 minutes max, and it's not as worrying as most people think it to be. This would allow us to see if you've got something called a hiatus hernia, which is a loose valve at the bottom of your gullet and the upper part of your stomach moving up into the chest, allowing food and acid contents to go up. So how do we treat heartburn and reflux? Well, lifestyle factors are key in controlling this condition. A lot of people manage their reflux simply by this and can manage it really well over long periods of time without needing medication. So the things I advise patients to do are the following. So lose weight if you're overweight, avoid eating late at night. And the reason for this is that it takes 2 to 3 hours for the stomach to digest the food that you've eaten. So if you go to bed with a stomach full of food, you will get acid reflux. I often ask patients to eat their main meals during their daytime rather than in the evening. Other things that help are to eat smaller volumes of food so it doesn't stretch the stomach and produce more acid. Sleeping with your head up. Now, often people use pillows, but these really don't work as most of us slip off the pillows. It's better to either raise the head end of your bed with some bricks or to use a wedge pillow. Apart from lifestyle factors, looking at food and drink is very important, and often I take the help of a dietitian colleague. There are medications that can reduce the acid production in the stomach, and these are called proton pump inhibitors. You might know them by their trade names like omeprazole, lansoprazole, pantoprazole, and so on. These should be taken for short periods of time, and the main focus needs to be on lifestyle modification. However, there are certain groups of people who need to take these medication long term, and your doctor or your specialist gastroenterologist will advise you about that. It's very rare for people to need surgery on a regular basis to help with the hiatus hernia and to reduce reflux. It is, however, available for patients who have refractory disease, which are having a huge impact on their life. I hope you find this information helpful. Come and see me, and I hope to be able to help you manage reflux and heartburn better. Thank you.